So the next talk is by Dr. Anup Kelgaonkar, and he's discussing My Eye or AI, the future of imaging.
At the outset, I want to thank AIOS, and it's a very difficult topic, trying to plan a trajectory of a newborn kid around the town. And my eye versus AI, I don't think it's really a topic of debate, but possibly a marriage between the two would be what we would have in the future. But let me start with what the AI is there for us at present. Most of the AI models that we have at present are LLM models. ChatGPT is what comes to mind. Google Bard, which is now Gemini. Twitter, the former Twitter, has its own model. Cloud is there, and Wisdom AI. I put one of my papers in cloud.ai, and it nicely summarizes the things for you. So if you put the paper, you can put it questions, and it would give you answers based on these papers. So churning a very large data would be very easy with this LLM models. Second thing that you can do is the LLM models have an interactive chat. They can decipher the patient symptoms, investigations, and if you put in symptoms, and the ChatGPT generally does a fairly good job to decipher that. It does come with various down points, though. I'll visit one more AI model, which is wisdom.ai, and you can just browse various journals, what the keywords are, what are the areas they have for focus on. I took an example of ocular immunology inflammation here, and it just shows up that what the topics are, probably the most research topics in this journal or during a particular time period. So the LLM models that we have can and are nowadays used for language, grammar correction, plagiarism checks, sentence constructions are there. The greatest limitation of them are they sometimes hallucinate. And the next models of the LLM do have the image processing capabilities, and they can do and generate image as well as evaluate them. Now, deciphering symptoms and investigations is something that has brought LLM models to the forefront. What people are trying to look up is, can LLM models be integrated into an EMR? And one of the greatest limitations of human brain would be we are unable to focus on years of follow-up, lots of symptoms, lots of medicines, and lots of investigations. And if patient comes up with a particular symptom, I have a headache, and we have to go back to the note, see, is it a drug complication, is it a disease complication, disease process affecting that, and there is where I think the AI could decipher all loads of investigations, multiple symptoms, and the long history that the patient has, and give you a clue on that. So these are probably what LLM models do with. Going on to the later stages where image recognition and machine learning are one of the predominant ones. So AI is the biggest circle that we have, and then machine learning, deep learning, and neural networks. Machine learning was the one thing that was done very oftenly in the sun classification. For example, when they come up with toxoplasma. So day-to-day practice, as we have been seeing in the morning, has been with fundus imaging, OCT, angiography in the uveitis. And can AI interpret these images is a question that we ask ourselves, and this is something as uncharted waters. Is it a boon or bane? Maybe the time would be a good judge of it. The chatbots versus human experts, there are studies predominantly by Dr. Rupesh Agarwal sir, and initial studies have shown that uveitis experts generally outperform the AI models, especially the ChatGPT ones. This was another paper where ophthalmologists excelled over the AI, but the times could change very faster. And there are newer segmentation models where fluid segmentation, trying to interpret the volume of that, trying to look at the macular biomarkers, geographic atrophy AI model, and other AI models are upcoming as the day pass, and they are interpreting the various indices that we see in the retina. One of the another proposed models is patient getting directly exposed to FFA examination by machine. The machine, which is an AI doctor, interprets all the phases, gives a diagnosis, and finally decides laser versus non-laser. One of the papers that translate this, takes this much further, is trying to create angiography images from fundus photographs, and possibly this could be a replacement to routine angiographies that we do. So these images in the first row are fundus photographs. These are the first image is a real venous angiography, and this is a generated venous FFA, and as seen in this paper, the images were comparable, generated by the AI as compared to the actual fundus fluorescein angiography was done. So these are generally the capabilities that AI has at present, and maybe years later they would go on improving. Most of the challenges that we have in uveitis is sometimes the disease has mimickers, it has similar presentations of various diseases, or a rare presentation of a common disease is what matters, and there would be subjective differences in opinions amongst uveitis practitioners, and I think if we let the AI churn this images, that would be one of the way to look at it. Automated diagnosis of ocular toxoplasmosis are the other studies being done in this era. But it is with cons. It can be with a lot of possible cons. One thing is, I have a very interesting example to give. There was an AI model developed to differentiate between a fox versus a dog. And this AI model used to perform very nicely. And at the end of the day, it started miscalculating about 1 to 2% of cases as labeling of this fox as dog and dog as fox. So the AI people went in to see what's happening. And it was seen that whenever there is snow, the AI used to say this is a fox. And whenever it was domestic terrain, it used to mark it as a dog. So sometimes we never know what the AI model is actually seeing. Is it actually seeing the area of interest that we want to or not, is a question that we need to ask. Furthermore, the accuracy of this data and data points is something that would still need a study, and MyEye, I think, is here to stay. And one few of the very points in favor of that is an ophthalmologist often is needed in especially research limited settings as our country, where we need to first ascertain whether the disease is there or not, if the uveitis is there or not, is this a case of uveitis, and then go for and doing these imaging modalities, which AI would then probably go forward and see. So I think the gray hairs and warm hearts of an ophthalmologist in the clinic are here to stay, though there are few models that say that we go into a room, the AI checks the images and does the OCT and interprets and possibly give to you. The time is there for those things to happen, but I think nothing could match a compassionate and empathetic counseling by probably a gray-haired and warm-hearted ophthalmologist. Thank you.